Assalamu alaikum. Ultrascan diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the upper right quadrant. As you can clearly see from this frontal view, that the upper right maxillary bone shows signs of perforations and loss of cortical architecture. As you can see here, the maxillary bone all the way is not does not have a proper architecture in terms of cortical bone. We've got a proper architecture on the upper left hand side. So we're going to take you through the panoramic view. Or on the panoramic view, you can very clearly see that upper right maxillary region has radiolucencies associated with the roots of the upper right anterior as well as the posterior teeth. We've got multilocular radiolucencies here, and now we're going to look at different angles to see exactly what picture it shows us. Now we're moving towards the axial view, which is basically the top to bottom view. On the axial view, you will be very clearly able to see these are the maxillary teeth. As you're moving towards the apex, you will be able to appreciate that on the right hand side there is an expansion, and here it starts. So this is the radiolucency starts. It's involving the maxillary sinus. It hasn't involved the sinus is not appeared on the left hand side yet, but as you can see, there is an expansion of the cortical plate quite significantly. This has the hallmarks of a amelioblastoma, but only a histopathological sample can confirm the diagnosis. It could be a giant cell lesion. It could be a amelioblastoma, multilocular amelioblastoma. You can see that there are specks of radio opacity here. Expansion of the cortical plate is involving the maxillary sinus as well, and here you can see the sinus on the left hand side versus the sinus on the right hand side. So we have no sinus basis because it involves the complete sinus on the upper right hand side. An expansion of the bone is quite evident on this view as well. Also of note, this does not have any impacted teeth, so we can't categorize this as a dentigerous cyst or a odontogenic keratosis because they're usually associated with impacted teeth. It could be a myxoma, it could be a osteosarcoma, a fibrous dysplasia lesion, or a aneurysmal bone cyst, but a histopathological evaluation is definitely needed. This is the coronal view, which is basically the front to back view, and here also you can very clearly see this is the molar region. We have a little bit of molar resorption as well. This is the molar region. This is the 7, where you can very clearly see resorption of the roots as well. As we move towards the front, you can see all the molars are involved. The premolars are involved all the way towards the canine, and this is where the lesion actually starts. We would refer this patient to a full head and neck CT scan for a better evaluation of whether this lesion is contained here or spreads further upwards. Thank you very much.